Good afternoon, everyone. I'm Sheila Kelly from PAGB. We're based in the UK, and Julie has asked me to come and tell you all about what's been going on about self-care in the United Kingdom. So if you come and join me in our offices just across there in Sicilian Avenue, I'll bring you up to date. I'll start this right at the beginning with the definition of self-care. Self-care in the UK doesn't just mean self-medication. It appears in all sorts of government documents, and it's connected with everything from minor self-limiting conditions where you're talking about self-treatment through to chronic conditions, even to hospital treatments, and almost everything that people do has some kind of element of self-care in it. Even with a chronic condition like diabetes, it's accepted these days that people see a doctor or another healthcare professional for maybe an hour a year, and all the rest of the time they're managing their diabetes themselves. In the UK, all of the healthcare is provided by the National Health Service. It's funded by taxation. People don't have to pay to see a doctor at all, and most people get their prescriptions free of charge. That's quite different from most countries in the world. Even when a medicine moves over the counter, in most cases it's still available for a doctor to prescribe it. Any kind of system these days that's funded by taxation is under incredible strain. Everyone wants more health care. We're getting to be an older and sicker population. We need to do something about this because no one wants to pay the extra taxes that would be needed to keep the NHS running the way it has been running for the last 60 years. So the government's plan for doing this is to start to move much more healthcare out of the hospitals, get the general practitioners to do a great deal more, and get people to do a lot more themselves in both managing their illnesses and preventing them. There's a target for achieving all of this. The aim is to do it all by 2020. So we only have about 11 years to achieve a major change. In order to do that, two things have to happen. One is that even more medicines have to be available without prescription. And the second one is that more people have to be prepared to treat themselves instead of going to the doctor. So I'm going to tell you what's been happening in the UK in the last few years since I last visited your conference, and let you see what's happening in these two areas. This slide shows how I've mapped it out. On the top we have patient autonomy, on the bottom doctor diagnosis. The left axis is short-term use and the right one is long-term use. So if we go back about 20 years, this blob shows you what self-medication was all about. It's minor self-limiting conditions. It was short-term use, headache, colds and flus, indigestion. For everything else, people went to the doctor. And about 10 years ago, that started to change. So we started populating that orange blob, still short-term conditions, but this time it's illnesses where maybe you needed the doctor diagnosis in the first place. So you've got arthritic pain, cystitis, insomnia, migraine. Eye infections just switched in the last couple of years. And just this year, just a few months ago, we switched products for treatment of chlamydia, where you're doing the diagnosis yourself. You have to actually buy a test kit and prove that you've got chlamydia before you can buy the product. And it doesn't stop there. We are looking now at anti-obesity drugs like Orlistat switching over the counter, and there's speculation about Viagra and anti-flu products coming down the track. So we have moved a lot of things in the last 20 years. The big difference between us in the UK and you in Australia is that in the UK, all the products can be advertised to the public. In the top right-hand corner, we're looking at long-term treatments. We're looking at conditions where you're preventing illness, not trying just to deal with symptoms. And there's been a lot of activity there as well. Smoking cessation products, allergy, indigestion, prevention of indigestion, and not just treatment of it. And of course, one of the most controversial ones, we've switched statins for prevention of heart attacks by lowering cholesterol. Perhaps I should just explain to you that the body in the UK that's responsible for this area of legislation is the equivalent of your TGA, is the Medicines and Healthcare Products Regulatory Agency, the MHRA. So like the TGA, they're an arm of government, And what they have been working towards is a policy that's been set by the government that says you have to widen access to medicines. Like the TGA, they're responsible for regulating products, for issuing marketing authorizations, for everything to do with the sale and supply of medicines. But also, they're also required to work to government policies. And for the past 8 or 9 years, it has been government policy to move more medicines from prescription control and to increase the range of products that's available for pharmacists to sell. So they're following this policy because it's been set down by the government. And it's part of this overall drive towards self-care and self-medication. And I have to say the MHRA have been great champions for this change, and I'm very proud of the fact that they're leading the world in this area. We're going to have a reception with them in a few weeks' time to celebrate 25 years of Switch. We're calling it not just a silver anniversary, we're calling it going for gold. There's plenty more to come. Now, the question that Juliet asked me, and everybody asks me, is you have all this Switch activity in the UK, but is it successful? Is it commercially successful? Are people buying the products? Well, I just got this slide just a couple of days ago to show you roughly how these various blobs work their way out. As you can see, about 90% of the UK market is still minor self-limiting conditions. We have products in there like Nurofen you have in Australia. Products for short-term use that need a diagnosis, things like the migraines, the eczema and so on, account for 2 to 5% of the market. And in the top right-hand corner, products for prevention, like smoking cessation, account for 5 to 8% of the market. So that you can see the majority of the market is still minor self-limiting conditions, but within that category, the brand leaders tend to be the ones that have switched from prescription control. We would all like to see a product which perhaps has taken years to switch and millions of pounds of investment to switch being far more successful. And that's what we're now trying to turn our attention to, finding out why that's not the case. So our priority now at PAGB is to try and to do something. We've moved all the products over the counter. Now we need to move the patients and get them to go to the pharmacy and buy them instead of going to the doctor in the way that they've been doing that for years. So we believe there was a huge potential there with people just automatically going to the doctor and not really thinking about self-medication. We commissioned IMS to work with doctors to find out how many of their patients were visiting them for conditions that they could have managed for themselves, to find out how many prescriptions were being written for treatments that people could have bought for themselves. It was really important for us to have this research because when you're talking to any government department, without research you really have nothing other than opinion. And in this case, we were talking about research that was going to lead into conclusions that were going to be drawn about workload and funding, and we really needed to have robust research that would stand up to scrutiny. So that's why we turned to IMS to do this work. The research that IMS did for us came up with some figures that were absolutely staggering. What they showed us was that 57 million consultations in the UK with a GP are for minor self-limiting conditions, things like headache, backache, indigestion, all those things that are the normal self-medication areas that people look after for themselves. 90% of the time that people go to see the GP, he just writes a prescription, again, for a generic version of something that they could have bought for themselves over the counter. In terms of drug cost, perhaps, we have a £9 billion drug bill in the UK. These medications are not that expensive, but the GP cost, that's the really big one. It's a staggering £2 billion a year, or 18% of their workload, used up in dealing with people with minor self-limiting conditions that perhaps could have managed them for themselves, maybe with the help of a pharmacist. So we're showing these figures at a time when the government wants the GPs to be doing more things which are currently being done in hospitals. They want them to do minor surgery, they want them to see more patients in the GP practice instead of going to outpatients, and the GPs are saying, we haven't got the capacity to do this, our workload is too heavy, we can't do any more. And what we're showing is, here's a way of releasing capacity, and the government is listening to us.